Yesterday I chaired a session on telemedicine for ventilator-dependent patients at home, and there was a very good discussion about how one can accomplish that. The challenge is that these are patients who often find it very difficult to get into doctors' offices because they have a lot of equipment. It requires several caregivers often to bring them in. So there's an enormous potential for monitoring these patients at home, and there was some data presented there suggesting that outcomes, especially in ALS patients, can be markedly improved if you institute fairly simple monitoring at home. So that was something that was of interest to me yesterday, and I think there's tremendous potential across the span of chronic respiratory diseases when it comes to home telemonitoring, a way for physicians and other care practitioners to provide better monitoring and management for these patients. Well, I think ultimately you're trying to improve patients' lives, make it easier for them, avoid their having to come into the hospital, and also being able to pick up the potential deteriorations that they may encounter before they become real big problems. In COPD, for example, there's been a fair amount of work done on home telemonitoring to pick up exacerbations, which are probably the biggest threat to COPD patients. They get deteriorations that often lead to hospitalization, a lot of morbidity and mortality associated with it. So if you can pick it up very early and intervene before it gets too far, you could improve their lives enormously. If you keep them out of the hospital, you can lower healthcare costs, their utilization of healthcare resources, and it makes things more efficient rather than have to have people trundling back and forth and missing these exacerbations. One of the big problems we have in the U.S. is that at the moment there is no reimbursement for home monitoring, for telemedicine at all. You get paid on a fee-for-service basis for face-to-face encounters with patients. So if all of my patients stayed home and I spent all of my time monitoring them telemetrically, I wouldn't get paid. So there is a problem that has to be dealt with there. In Europe, where a lot of the physicians are on salaries already, it's not as big a problem. Not that I'm aware. The insurers in the U.S. are not looking for new ways of paying physicians, so this has been brought up. It has gone nowhere as of yet. I think as more evidence comes in establishing the value of this approach, they're going to have to pay attention, but as of yet, there's really been no movement to change things. I think so. I think we are going to see more research in this area. There's clearly a lot of interest. I mean, there have been important developments. Using smartphones is one of the ways that people can do this. There's so many applications. You can monitor their oxygen levels, breathing rate. You can take videos using a smartphone so that physicians in a remote location can see what's going on. There are many, many things related to the technological advances that we can now apply in the home, and I think it's just a matter of time before we start to accumulate the evidence that shows that using these things is beneficial in certain ways. And we'll learn better what things work, what things don't. But oh yeah, we're going to make advances in understanding how best to use these things. That's very daunting. The ERS meeting is a great meeting. There's a tremendous amount of very valuable content here. But in the few days one has to attend, you can't get to more than a fraction of what's being offered. So I have certain interests. I look through the program and I see what they're doing. They have apps now, of course, so you can search for keywords related to your interests and you find out what's being presented, and then you prioritize and go to the sessions that are going to be of most interest. One of the things I do try to do when I'm at these meetings is update myself on things I don't necessarily pay a lot of attention to the rest of the year, and try to keep track of those developments. And so, selectively I'll pick out some of those. If you spend all your time at the meeting every day, your mind tends to go to mush. So you need to leave some time to do other things. So I'm in London. London's a great city. I've been to the Tower of London, where I've never visited before, and toured it the other day. My wife is here, so that also takes a little bit of time. My wife doesn't want to sit in the hotel room while I'm attending meetings. So there are a lot of tensions that you need to make some attempt at balancing things. And it's really challenging. And when I go home, I'm kind of, maybe meeting fatigued by the time I get there. To a certain extent, medical students are working very hard to build, the fundamental blocks of learning the language, the thought process, the approach in medicine. And we are very specialized here. And we have a vocabulary that is very sophisticated. And so unless a medical student has a special interest in respiratory medicine, they probably won't get a whole lot out of it, and it will be overwhelming. It's overwhelming enough for me, let alone someone who doesn't have my many years of exposure and understands how these meetings work and everything. So there may be a few medical students out there who would get something out of coming to this meeting, but I wouldn't encourage medical students to attend this meeting just to attend the meeting. I've been associated with the American Thoracic Society for many years, and we have brought medical students to our meeting to try to expose them to respiratory medicine, but we're very selective. We bring them to certain sessions that are geared for them, and we're trying to stimulate their interest in the field so that eventually, they might consider going into it. But unless you do it that way, I don't think most medical students are going to get much out of it. We're making a lot of advances in a lot of fields. In my fields of greatest interest, pulmonary hypertension, for example, there are a number of new pharmacotherapies that are under study. We're going to hear about them at this meeting. COPD gets a lot of attention at this meeting, and there are many, many advances, not only in terms of pharmacotherapies, but approaches in terms of how best to rehabilitate these patients, how to help them with their lifestyle. So I think the message is, we need to keep up with these developments in the field that are constantly happening, and this is why we come. What's going on this year? We network with people who have similar interests and find out what they're doing, and I think these meetings are very valuable in that sense. We share ideas, we build on each other's progress, and this is how we get ahead. Well, I find it very frustrating to work in the U.S. health system. I think our capabilities are without compare in the world in terms of the technological advances and the advances in basic science and so forth. But our payment system is horrible to work in. It's just so disorganized, and you've got all these private payers and you've got the public payers, and You've got this crazy system of reimbursement, and now our documentation standards have gone up, so we spend a lot of time documenting. I think in many ways the European systems work much, much better. I think the physicians in Europe tend to be less frustrated about those aspects. They certainly have plenty of frustrations, but you know, I think they're less frustrated about that. So I wish our system could work a little more efficiently and be a little less crazy than it is, but it's largely determined by political forces and money and power, as is the case in many things in many societies. I'm not real optimistic that that's going to change for the better in the foreseeable future, but you know, I would like to see us function more efficiently and more rationally as a medical system.